Swayam Prabha. Digital India. Educated India.
Hello dear students, welcome in this module, and in this module I am going to tell you about pharmacopoeias, different pharmacopoeias, Indian Pharmacopeia, British Pharmacopeia and United States Pharmacopeia. So in this subject, dispensing pharmacy, Pharmaceutics I. So dear students, I am Dr. Mona Semalti from HNB Garhwal University, Srinagar Garhwal. I welcome you all in this module. So dear students, after going through from this module, you are going to learn about pharmacopoeias, what is the definition of pharmacopoeia, monograph, and the description about the Indian pharmacopoeia and the different contents of Indian Pharmacopeia, British Pharmacopeia and United States Pharmacopeia. So this is going to be your lesson plan. So we will follow this lesson plan. So dear students, if I try to explain you about Pharmacopeia in a very simple way, Pharmacopoeias are just like Bible, Quran or Gita. For pharmacy professionals, okay, for pharmacy students, for pharmacy persons who are involved in the who are involved in academics or in pharma industry, or anyhow they are associated with the pharmacy profession. So pharmacopoeia, it is derived from Greek word pharmakon, means drug, and poia, that is to make. It means is to make, that means making of drugs. So it is a legal and official book issued by the recognized authorities, usually appointed by the government of each country, okay, and it comprises of a list of pharmaceutical substances, formula along with their description and standards to be followed in a particular country as well as worldwide, and if it depends a specific or particular country adopts the standards of which pharmacopoeia. Now this is also very important for you to know about the monograph. So what is monograph? A complete description of a specific pharmaceutical which include nomenclature, classification, physical characteristics, doses, purity and limits for impurity, identification, assay and the condition of storage. So this is a complete description. This is the definition you can say of a monograph. And if a monograph of a specific drug, it contains the following things. So it comprises of a monograph. Now list of pharmacopoeias. Indian Pharmacopeia, United States Pharmacopeia, British Pharmacopeia, Russian Pharmacopeia. So there are many pharmacopoeias available worldwide for each country. Each and every country, depending on their researchers, their complete background of their drugs and pharmaceuticals. So they update their pharmacopoeia on yearly basis maybe. So different countries have their own pharmacopoeias and their own pharmacopoeias and their standards they have. So this list you can see on the slide that there are different types of different pharmacopoeias exist all over world. Now we will talk about Indian Pharmacopeia. So in Indian scenario, what all standards of drugs are there, what type of monographs are there. So we will discuss about Indian Pharmacopoeia. And before independence, British Pharmacopeia was employed as the official book of standard in the official book of standard for drugs and pharmaceuticals. And the very first edition of Indian Pharmacopeia was published in 1955 under the chairmanship of Dr. B.N. Ghosh. Okay, and now second edition, it was introduced in 1966, and it was having many drugs, crude drugs and their preparations. The third edition was of the IP. It got published in 1985. The first edition in 1955, second edition in 1966, and the third edition in 1985. And addendum first of the third edition, it was published in 1989. Okay. Now, IP has several editions and volumes, and third edition when it was introduced in 1985, okay, with the 2 volumes and 9 appendices. Fourth volume of IP in 1996 under the chairmanship of Dr. Nityanand. Volume 1, it contained notices, preface, acknowledgement, introduction, general notices, monograph from alphabet O to A, and second volume alphabet from P to Z. Fifth edition of IP in 2007 it was introduced, okay, and fifth edition of IP was published in 2007, and addendum to this edition was published in 2008, and it has it had 3 volumes. Volume 1, general notice and general chapters. Volume 2, different monographs and different monographs from alphabet A to M. And in the third volume, it contained monographs of drug substances and dosage form and pharmaceutical aid from N to Z. Sixth edition, it was introduced in 2010. This I am telling because, dear students, sometimes it is asked about these editions, that when the first edition of Indian Pharmacopeia was introduced. Okay. What about the third edition of Indian Pharmacopeia? So as we are pharmacy professionals, pharmacy persons we are, so we should have knowledge about these different editions. Although these all editions, every time when the new edition of Indian Pharmacopeia is introduced, so sometimes the authorities they do little addition or deletion depending on the complete requirements of drug and pharmaceuticals. So 6th edition, it was introduced in 2010, published by Indian Pharmacopeia Commission, IPC, Ghaziabad, and it was presented in 3 volumes. Volume 1 contained notices, preface and structure of IPC, acknowledgements, introduction and the general chapters. Volume 2 contains monograph. Generally, just to remember broadly, volume 2 contains monograph from alphabet A to M. Okay, and volume 3rd, it contains monograph from N to Z. N to Z, alphabet N to Z, followed by monographs on vaccines and immunosera for human use, as well as herbs and herbal products, and blood and blood products related, and biotechnology products. So all these things. And in 2010, the scope of Pharmacopeia has been extended to include the products of biotechnology, indigenous herbs and herbal product, as well as veterinary vaccines and additional antiretroviral drug and formulation. Okay, so it was introduced in 2010 in the 6th edition of Indian Pharmacopeia. 7th edition, of Indian Pharmacopoeia was published by the Pharmacopeia Commission on behalf of Government of India, Ministry of Health and Family Welfare in 2014. Okay, in 2014, and it was presented in 4 volumes. Now, 7th edition of Indian Pharmacopoeia, as it was it came in 2014, and it incorporates 2,550 monograph of the drug, out of which 577 are of new monograph consisting of API, excipients, dosage form and herbal products. Now I am going to tell you about the content of monograph. So dear students, it is very important for you to know that what does a monograph contains. Okay, the contents of monograph, or you can say the description of monograph. Alright, so the very first thing, a monograph has title stated in English, and it refers to the official name of compound. Sometimes subtitles, if any, are also given. So these are synonyms, and it could be used in the place of main title. Say for example, calcium carbonate can also be called as a precipitated chalk, and milk of magnesia can also be called as magnesium hydroxide mixture. Okay, so this way the very first description of monograph is title. Now, second is its molecular weight formula and weight. Following the title of the drug substance, a chemical formula of the pure compound is mentioned and its molecular weight. Okay, second thing. Third thing, in monograph we have category of the drug, which is very important. Describes the therapeutic and pharmacologic or pharmaceutical application of compound. Generally we call which category of drug it is, right? Category. So that category is mentioned in monograph at third place. Third description is about the category, and next is dose. Quantities for the guidance of prescriber, of the physician, to achieve the desired therapeutic effect in adult. So what is dose? This is only is the dose, that the quantity of the guidance of the prescriber or a physician who prescribes a specific quantity to achieve the desired therapeutic effect. Alright, so it can be altered as and when required. So depending on in the coming additions, based on the researches and based on the conclusions of the researches, so it is updated as and when it requires. Description. Now it gives a physical description of the substance, like crystalline, if it is a crystalline, or amorphous form, color, odor, taste. So this property basically helps in the preliminary evaluation of the integrity of an article, or this is going to help the researchers and pharmacy persons to know about the preliminary, to have a preliminary idea of its physical properties. Solubility, next thing, is described in the popular term. Say for example, completely soluble, partially soluble, sparingly soluble. So dear students, solubility and it is the different ways or different I can say the classification of solubility. It is generally it's very important to know for all of you to. So please go through from the Pharmacopeia, where it is mentioned in the beginning itself regarding the solubility criteria, different solubility criteria. So just go through from those solubility criteria. So solubility is mentioned in the description of a monograph after drug substance description. Standard, it is very important part of monograph, which specifies the quantitative purity of title compound. Okay, so where the compound is of definite composition, for example, potassium bromide is having not less than 98% of KBr, calculated with reference to the dried substance. So this way standards are mentioned, and standards are stated in monograph of the Pharmacopeia apply only to the article which are intended for medical use. Alright, moving to next one. This is identification. So identification, this usually involves the specific chemical test or test for identifying the substance, color reaction and precipitating test and gas evolving reaction, which are commonly used for inorganic pharmaceuticals. So identification. And next is pH. pH, the pH value given in the monograph for the guidance of manufacturing pharmacists to develop various dosage form and to avoid the physiological complications. So pH is also mentioned. So if you don't know the pH of any drug substance, so we call it as like go and refer the Indian Pharmacopeia. So Indian Pharmacopeia has all these things in the description of monograph. And next is limits for impurity. For different chemicals, different limit tests have been included. So as also different amounts of such impurities are permissible for that chemical. So this is also mentioned in the description of Pharmacopeia. Description of a drug in Pharmacopeia, in Indian Pharmacopeia. Okay. The next description is about the limit test for impurities, which are generally represented in parts per million by weight, ppm, or as a percentage. So these are approximate values. Assay, okay, this is very important, and assay step by step description of a chemical analytical method for active substance. If the assay method described in the Pharmacopeia is applied to a chemical, the standard prescribed in the monograph earlier should be realized. Okay, so next is about the condition, storage condition, about that particular dosage form and drug substances which is prescribed in the which is there as per the standards of Indian Pharmacopeia. And next thing is about the containers. Okay, container in which the drug in which container it is the device that holds the article. So the immediate container is that which is in direct contact with the article at all the times. So well closed container, tightly closed container, and light resistant container. And so these descriptions are given for a particular drug substance or dosage form in Indian Pharmacopeia. And if we take another example like single dose container and the precautions to be taken, and there is a possibility of effect of atmosphere, moisture, heat and light. So all this information is provided along with say for example, if we say the ferrous fumarate, so stored in a light resistant container, and insulin injection stored in multiple dose container. So all this are included in the description. So next is about the appendix. So list of appendix is there in Indian Pharmacopeia. So what all it contains? Appendix 1, it describes the apparatus that are required for various pharmacopoeial tests and assays in particular standards and tolerance. Appendix 2 describes the biological test and determinations, which involves the design and analysis of results of biological test and assays. Appendix 3 lays down the details of various chemical test and assay. It involves identification test, limit test, analysis of fixed oil, analysis of vegetable drugs, and general titration and assay procedure. So all these things Appendix 3 contains, and 4th appendix describes in detail about the chromatographic and electrophoresis technique. 6th Appendix 5 spectrophotometric method it has. Appendix 6 involves the clarity and color of solutions. Disintegration, dissolutions are part of this appendix. Now Appendix 7, disintegration and dissolutions are part of it. 8 describes the determination of boiling or distillating range and congealing range, ethanol, freezing point, jelly strength, loss on drying, loss on ignition, melting point, optical rotation. So all this information is given in Appendix 8. So dear students, you might be thinking that why we are discussing all these appendix here. This is because you should little understand about what all this appendix is all about basically. So if someone asks you, okay, what is there in Appendix 1? So you should have a little idea about that. Yes, Appendix 1 of IP contains this information for all the drug substances or dosage form, right? So that is why just go through it once and try to be familiarized with this appendix content. I'm not going to just recall and remember all those things which are mentioned there. Just remember that what it contains. Okay. Say for example Appendix 9, it contains the microbiological assay and test. And Appendix 10, what it contains and it describes the limit test for a particular matter. And other tests and containers and closures are given in Appendix 11. So if you want to refer any specifications for container and closure for Indian as per the Indian Pharmacopeia, so you are going to, what you have to do, you have to refer Appendix 11 for that. Appendix 12 describes the general information regarding the cleaning of glasswares, okay, dimensions of capsule, shell, sterilization procedures, biological indicators, and water for pharmaceutical use. So these appendix are also important theoretically for you to understand about. Say for example sterilization, you want to learn about sterilization. So it's the best reference that go and refer Indian Pharmacopeia for the sterilization. So there is given and is presented very nicely in Indian Pharmacopeia. Okay, so that is why also this appendix are important for you to know about. And Appendix 13, which gives the preparation of reagent and solution like buffer solution, general reagent, indicators, indicator test paper, and standard solutions and volumetric reagent solution. Alright. And 14th appendix describes the reference substances. Table of name, symbol, atomic weights, elements. So these are there in Appendix 15 of Indian Pharmacopeia. Now, dear students, moving to British Pharmacopeia. There are, as I told you in the beginning of this module, that there are a number of pharmacopoeias available worldwide, country-wise, I can say rather. So, but Indian Pharmacopeia, in Indian context, it is the standards of Indian Pharmacopeia are followed, and British Pharmacopeia, it is also very commonly adopted Indian Pharmacopeia in many countries of the world, as well as United States Pharmacopeia. So that is why I have included only 3 pharmacopoeias for your introduction: Indian Pharmacopoeia, British Pharmacopoeia and United States Pharmacopoeia. So now moving to British Pharmacopoeia. See, British Pharmacopoeia, it is the national pharmacopoeia of the United Kingdom. Okay. Now, British Pharmacopoeia, it is an important statutory component in control of medicines. Along with the British National Formulary, it defines the United Kingdom's pharmaceutical standard. So, okay. Now, British Pharmacopoeia is a national, it contains the national standards of drug substances for United Kingdom, and it is the official collection of standard for United Kingdom's medicinal product and pharmaceutical substances, published annually. Okay, and it contains monographs for pharmaceutical substances, formulated preparations and other articles used in the practice of medicine. So dear students, as I said, British Pharmacopoeia, it is published annually, and the very first edition of British Pharmacopoeia, it was published in 1864, and it consists of two sections: Materia Medica and Preparation and Compounds. Now, the current edition of British Pharmacopoeia comprises 6 volumes, which contains nearly 3000 monographs of drug substances, excipient and formulated preparations. So, in addition to expanding number of monographs for licensed formulated products, the BP supports the regulatory work in the field of herbal and complementary medicines by providing additional new revised monograph of herbal product and for homeopathic stock and for mother tinctures. British Pharmacopoeia. Okay. This is about British Pharmacopoeia, and British Pharmacopoeia, if we talk about British, in 2013 BP edition, it was launched in 6 volumes, 6 printed volumes, including BP Veterinary 2013, which was new for year 2013, and 41 new BP monographs and 40 new European Pharmacopoeia monograph and 619 amended monographs, 6 new and 1 amended in infrared spectra. These were included in British Pharmacopoeia. So currently the latest volume which is recently launched for British Pharmacopoeia is in year 2019, and latest edition for Indian Pharmacopoeia, it is 2018 edition, and United States Pharmacopoeia, which is latest edition, is 2020, which is going to be implemented from November 2020. Okay, so it was about the latest editions of these 3 pharmacopoeia. Now little I will tell you about the United States Pharmacopoeia. The very first edition of United States Pharmacopoeia, it was published in 15 December 1820 in both English as well as in Latin language. Okay, from 1820 to 1842, it was published in 10 years interval. From 1942 to 2000, it was published in 5-year interval, and from 2002 onward, it is published annually. First national formulary of United States appeared in 1888. Prescription and over-the-counter medicines are available in United States must by federal law meet USP and F public standard where such standard exists. Okay, so this is specifically for United States Pharmacopoeia. Now, USP establishes written, documentary and physical standard for medicine, for food ingredients and for dietary supplement product and ingredient. So these standards are used by regulatory agencies and manufacturers to help to ensure that these products are of appropriate identity as well as appropriate strength, quality, purity and consistency. So USP 800 is an example of publication created by the United States Pharmacopeia. So USP standard for food ingredients may be found in Food Chemical Codex. Okay, this is FCC. So the FCC is a compendium of standard used internationally for quality and purity of food ingredients like preservative, for coloring, coloring and nutrients. Okay, USP also conducts verification program for dietary supplement product and ingredients. So these are testing and audit program basically. So product that meet the requirement of the program can display USP verified dietary supplement mark on their label. Okay, this is a different from seeing letter USP along with the dietary supplement on the label, which means that the manufacturer is claiming to adhere to the USP standards. So USP does not test such products as it does with USP verified products. So European Pharmacopeia now. Moving to European Pharmacopeia. European Pharmacopeia Commission started working in 1964 to prepare the European Pharmacopeia editions. So now you can look at the slide about the different editions of European Pharmacopeia. So since its 5th edition, the Pharmacopeia is published in 2 volumes. Volume 1 contains general chapters and monograph. Okay, and volume 2 it contains all substance monograph. During runtime of current edition, several supplements are published. So it was about the European Pharmacopeia. So dear students, coming to end of this module. In this module, we discussed about different pharmacopoeias. Okay, Indian Pharmacopeia, British Pharmacopeia, United States Pharmacopeia and about European Pharmacopeia. So but we in detail we discuss about our Indian Pharmacopeia from its first edition to the current edition available. What is the definition of pharmacopoeia, monograph and the description of monograph, that it contains title, molecular weight, molecular formula, description, okay, storage conditions, assay. So all these things it contains a complete monograph description we studied, as well as about the British Pharmacopeia and United States Pharmacopeia, as well as about the European Pharmacopeia. And the latest edition 2018 IP is launched in 2018, and for British Pharmacopeia the latest edition is 2019, and for USP 2019 edition is running, and in November 2020 the new edition of USP is going to be launched. So dear students, Pharmacopeia, I have given you the little introduction about all these pharmacopoeias. So please go through from this module, and I really hope that you have enjoyed this module, and stay tuned for more videos, and thank you so much for watching this video.